I'm Alex Guerrero. I'm a trauma surgeon based in New York City, but I've worked, trained, and done research throughout the world. We've developed the Visual Information Zonal Reminder System for Google Glass in order to put the checklist in your hands, even when your hands are full. Checklists have been used by the airline industry for decades. It's helped pilots follow particular procedures and to maintain situational awareness of the aircraft, even when things aren't going well. It's also been used in elective surgery to make sure that the right patient gets the right surgery. For example, patients that are having surgery on their legs, they make sure that the correct leg is operated on. The challenge has been applying those same checklists in extreme emergency surgery, such as trauma surgery. Yes, for example, when somebody comes in and they're what we call moribund, they're right on death's door, they're bleeding to death, the trauma surgeon has to decide almost immediately whether the patient needs to go to the operating room or not. Once in the operating room, they have to manage a complex sequence of medications, logistical things such as massive transfusions, and ensuring that all the instrumentation is ready for whatever they may need to operate on. They're making sure that all of this is available at the same time while they're actually doing a surgery on a patient that could be bleeding up to a liter a minute. Right. So in addition to having these time-based checklists that we use in like high-pressure, time-sensitive situations, we've identified the need to use checklists in very complicated tasks that require extreme attention to detail. We've been using these successfully in the intensive care unit to make sure that we hit all of the details that are necessary in managing a complex patient. And we've also found that the placing of a level 3 personal protective suit on and off is extremely detail-oriented and is extremely complicated. So, for example, when dealing with an Ebola patient, putting these suits on and off requires a lot of attention to detail and a lot of steps that are very difficult to commit to memory. Well, since both surgeons and healthcare workers that would be putting on and off these Ebola-type protective suits need to be hands-free, everything is fully voice-activated. So for the first example, to put on and off the Ebola suits, we use a program called Ebola Controller. And it would simply go like this. Okay, Glass, start Ebola Controller. Next. Okay, Glass. Next. Okay, Glass. Next. You would go through this for the entire doning procedure, and at the conclusion, you would simply say, okay, Glass, close program. The next application I use is called damage control, and it's the one that I use when I do emergency surgery. It basically works by providing you with a preoperative checklist for the most commonly forgotten aspects of emergency surgery. And then when you're ready to actually start your case, you just say, begin. It looks like this. Okay, Glass. Activate damage control. Okay, Glass. Start case. It continues with this visual timer, and every 10 minutes it provides a chime that's actually transduced through my skull so nobody else can hear it. And it reminds me to stop, tell the rest of the team where we're at in the case, and get a quick report from the anesthesiologist and from the nurses, and for me to tell people what instruments I'm going to need as the case progresses. For every 10-minute block, it provides me with 5 clinical points and logistic points to work on for those 10 minutes. So for example, there's no clinical points in the beginning, but for the second 10-minute block, it's already asking me to follow up on the lab test that we sent when the patient first arrived, and to find out how much blood we're losing in the case. At the end of the case, I simply say, okay, Glass, stop case, and it gives me a postoperative checklist. The postoperative checklist reminds me to dictate my case, speak to the family, and to schedule the follow-up case for the next day, which is easier to do when you're at the first case. The third program I use is called Trauma Team Leader, and it's a program that we use when a patient first arrives in the emergency room for the first 20 minutes of the evaluation of a very seriously injured patient. You can run through a generic patient and just say, activate Trauma Team Leader, OK glass, and I get a checklist of things to ask the paramedics as they're dropping the patient off. For example, what happened, but more commonly, we ask about forgotten things, such as how much pain medicine did they get and how much IV fluid did the patient receive. Once the patient is moved over to the main bed, we say, start trauma eval, and a checklist and a timer begin. The timer runs in my peripheral vision, and every 2 minutes I get a chime that reminds me to check the blood pressure, and for that 2-minute block, I get a new checklist of things to focus on. So in the beginning, the checklist tells me to remember to have blankets to cover the patient as soon as we cut their clothes off, and for the second block, it's already to decide whether the blood bank needs to be called, whether the patient needs to go to the operating room, or if I need to start calling up backup surgeons. Now, it gets more interesting because Trauma Team Leader will also manage complicated patients that we don't see very often. For example, scenarios which are rare, such as a pregnant woman being shot or having to operate on an infant. So we just say the clinical scenario, and Trauma Team Leader actually starts to provide us checklists specific to those patients. It's very interesting. Now, it will also manage multiple patients at the same time. So if I had 5 patients that arrived, I could say the scenario, and each of those patients would run on their own, like this. OK, glass. Start second patient. Pregnant woman. OK, glass. Start case. Now let's say that the next patient was a patient who was strangled. I would move to the next screen, and I would simply say, OK, glass. Start third patient. Strangulation. OK, glass. Start case. Now I'm managing multiple patients, and they're each color-coded with different chimes, so I know when each patient has reached the milestone, and I can toggle between them. The Google Glass is then connected to the hospital intranet, so through an encrypted website, somebody at the hospital could see what I'm seeing in order to manage and see the checklists. This would be valuable if you had a mass casualty situation and you set up an incident command center, and the commander there could monitor what's going on in the trauma bay through the Google Glasses of the surgeon. With traditional Google Glass, there's a lot of privacy concerns, mostly because the patients could be recorded, photos could be taken, and because the Google Glass communicates with the Google servers. These Google Glasses have been modified in that the lens is actually covered with a cap. So there's absolutely no privacy concerns, and no protected health information is collected. Testimonially, we've had a very good response. Patients believe it represents sort of a new milestone in clinical care, and the privacy concerns have not been an issue at all. In addition, we're doing a study right now looking at patients' perception of Google Glass so that we'll be able to quantify their response in the future. We license the software to the clients, and they decide what information goes onto the checklist. So they provide the clinical and logistic information, and we provide the platform. Included in our licensing, we also provide software updates and support. They could go to traumaready.com, and we'll be happy to set up a demo.